In this video, I'm going to talk about one of the most important things you need to know if you're thinking about getting a platelet-rich plasma injection for your knee: dosing. Stick around to the end to find out the 3 questions you need to ask your doctor before you get a PRP injection, and to find out how your age may play a role in terms of how we dose your PRP. Last week, I got a text from a friend showing me some pictures from his recent knee replacement surgery. Pictures looked okay, but he was having a rough recovery, and he asked if I knew anyone down in Atlanta who offered laser therapy, since this was something we gave him 5 years ago. He also said he was really happy that the PRP injection we did for him 5 years ago helped him to delay knee replacement surgery for all that time. Way back then, at age 48, he was ready to have his knee replaced, and a single PRP injection helped to reduce the pain so much that he forgot about surgery. I put him in touch with one of my buddies in Atlanta. I really hope he starts feeling better soon, but I didn't ask him the question that seems so obvious to me. Why didn't you just get another PRP injection? When you have a headache and you look in the medicine cabinet, you don't reach for the children's Advil, do you? Of course not. You're going to take an adult strength dose. This might be 2 tablets or maybe even 4 if the pain is severe, but obviously the dose is important. If you're like my friend and you have an issue with your knee or your shoulder and you don't want surgery, you may be thinking about PRP. If you are, you need to make sure that you're getting a dose of platelets that is going to get the job done. And the only way to get a good dose of platelets is to draw out the right amount of blood. It's that simple. If you're enjoying this content, please be sure to subscribe to our channel to learn more about platelet-rich plasma and all the other ways we can provide solutions without surgery. When we make PRP, the smaller the amount of blood we take from you, the fewer the platelets and the weaker your PRP will be. You don't want weak PRP, do you? No, you don't. That's like taking a baby aspirin for an episode of kidney stones. It won't work. In order to get a good dose of PRP, you need to get a good amount of blood from the patient. Most of the time, you need a minimum of 50 cc's of blood. Sounds like a lot, but it's not. But sometimes even that's not enough. How do we figure out how much blood we need to draw for your PRP? Well, that depends. If you're in your 20s, you've got a normal platelet count, then 50 cc's of blood is probably going to be plenty. But if you're a little bit older like me or my friend, you may need more, or you may want more platelets in your PRP. Plenty of studies are now showing that the older we get, the more platelets we need in our PRP in order to have a good long-term outcome. Like my friend, a good reference number is 10 billion platelets for a PRP injection in your knee. If all these numbers are confusing, don't worry, we got you. You just need to make sure that your doctor is measuring your baseline blood platelet count and also measuring the platelet count in your PRP. How can we do this? Simple. We use the same machines that labs use to check for infections and anemia. It's called a hemoanalyzer, and it allows us to check your baseline platelets and PRP platelets before we even start. And if we check your baseline platelet count and it's a little bit low, no problem. All we need to do is draw out more blood to get to that target dose of 10 billion platelets. In some cases, you and your doctor may also decide that you want to go with a double dose of platelets. No problem. All we need to do is draw out double the amount of blood. You want to know a secret? Most doctors don't measure these things. They just wing it. The machines we use to measure platelets are expensive, complicated, and you need a well-trained team in order to use them properly. So it's not surprising that most doctors don't even bother measuring platelets. But it is kind of surprising that even in 2024, most doctors don't even have a clue about the importance of dosing when it comes to PRP. Even more surprising, there are still plenty of doctors using kits to make PRP that make really weak PRP. Like instead of 50 cc's of blood, they take 10 cc's. Crazy, right? All right, I admit it, 10 years ago, I was tricked into buying these weak PRP kits too. But then again, 10 years ago, I was making calls on a Motorola flip phone. It's 2024, guys. So here are the 3 questions you need to ask to make sure that your PRP dose is the right dose. First, ask your doctor if they measure your baseline blood platelet levels. If they don't, why not? And if they're not measuring your baseline blood counts, how do they know you don't have a low-level infection going on? I've seen this, and I've canceled procedures. Does this sound good? No, it doesn't. Second, Ask your doctor what dose of platelets you'll be getting during your injection. If they give you a funny look or they're clueless and they can't give you a simple, straightforward answer, maybe you should keep looking. And third, ask your doctor if they're considering your baseline platelet levels and your age when figuring out what dose of PRP is best for you. It turns out that in many situations, once we get above the age of 25 or so, we need more platelets to get the job done right. Don't feel bad about asking questions. After all, it's your body, your blood, and your moolah. Why not get it right the first time? All right, thanks guys, that's it. If you'd like to subscribe to our newsletter or book an appointment, click on the link below in the description.